you say? Hey guys, if everybody could please find a seat, it's time to get started. Thank you guys so much for coming. We have a really great turnout and great energy in the room. It's a beautiful day. I think we might actually be short on seats. There is a very beautiful vintage boat in the back that has some seats. I don't know if you're allowed to go into it, but you're welcome to try if you want to have a seat there. As we get started, it's my great honor to introduce Chef Hélène Desroses. She is a world-renowned culinary artist, a proud 3 Michelin star chef whose dedication extends well beyond the kitchen. Her efforts to fight malnutrition and support sustainable food practices are really, really inspiring. She's very, very well known here in France and beyond. Chef Desroses, we are deeply grateful for your commitment to this cause and for joining us today for this conversation, and also for providing us with these amazing desserts that I hope everyone's had a chance to try. Chef Desroses, would you please come in and join us for a few remarks?
Mesdames et messieurs les ministres.
Ladies and gentlemen, ministers, members of parliament, ladies and gentlemen. Now, if I'm here this afternoon, it's to convey a number of important messages. First of all, I'd like to say that cooking is not just about feeding people, it's about imparting values, souvenirs, emotions, traditions, and so forth. Food is a universal language, one that speaks to all cultures and to different generations. As a cook, and really a cook because I don't like the word chef at all. So as a cook, I have always cooked with my heart and have always worked with local produce in season, and with a great deal of respect for all the people who have grown and made these products that we work with. I'm here today as a woman, as a cook, as a chef, but I'm also here as a mother, since I have 2 young daughters, well, probably not that young, now they're teenagers. And I'm here also as a mother because as soon as you become a parent, you become aware of the fact, and really aware of the fact that food is extremely important. This is also the moment in our lives when we realize what we feed our children then shapes their future. I often say that we are what we eat, and that is true from a very young age. Every mouthful counts, and every nutrient counts as well. Any child that suffers from deficiency is a child that will not develop as well as others, a child who will be weaker, more vulnerable, and a child who will have greater difficulty to learn and be a good pupil at school. And a word now on women and on future mothers who feed themselves and, of course, their babies. They also look out for the rest of their family and sometimes actually feed others, but do not feed themselves properly. Let's not forget that it is precisely the rights of women that are often overlooked when we discuss poor nutrition. Today we have millions of women, millions of mothers who suffer from micronutrients deficiency, suffer from anemia, in a world where we know that maternal health is so important. This is very much a silent scourge that you cannot see, but nonetheless does wreck lives. Malnutrition is the first cause of infants' death. 1 out of 2 deaths for children under 5 is attributable to malnutrition. we have 45 million children who suffer from malnutrition. More than 1 billion young women suffer from malnutrition and its negative effects. This is a stark reality and a tragic one as well, especially in light of the fact that we have simple and efficient solutions like all the vitamin and minerals and the food supplements that already exist out there for both children and for pregnant women, which would help reduce preterm births. And these food supplements and these solutions have proven to be efficient. So why do we have so many women and children who do not have access to these supplements? I believe that we need to act and to act now. Eating food and the right kind of food should not be a privilege. It should be a right. In France, we have turned food into a form of art. We take a lot of pleasure in eating. But what's the point of all of this if we are indifferent to the people who don't have the bare minimum? I am convinced that gastronomy and food can be a driver for change. Cooking and preparing food for others is not just about simply feeding people. It's also making a statement about better food for more people and access to food for more people. I would like to see a world where women and children do not suffer from deficiencies. So let's use our power, our influence to improve our world. The discussions that you will have today on maternal health and on prenatal vitamins need to lead to practical commitments for women and children around the world. It's so important for everybody's life. Thank you very much.
Desserts back in the corner, so please help yourselves after the event. Good afternoon again to everybody. For those of you who I haven't had the pleasure of meeting yet, I'm Will Moore. I'm the president and CEO of the Eleanor Crook Foundation. At the Eleanor Crook Foundation, our mission is clear: to fight for a world where malnutrition is no longer robbing women and children of their futures. It's truly a privilege to be here today in this room filled with people who are not just talking about solutions, but driving them forward. Before we go forward, I'd like to highlight just a few quick housekeeping notes. First of all, the event is bilingual, as you've probably already noticed, but French and English translations are available, so if you don't have a headset, there's one in the back. Please go ahead and grab one. We are live streaming today's conversation on YouTube, so for those of you joining us virtually, they're on the cameras, welcome. To our esteemed ministers and governments in the room, I want to really welcome and thank each of you. Your leadership is why we're not just talking about whether MMS works. We're talking about how fast we can get it to every woman who needs it. And lastly, a huge thank you again to our chef, Hélène Desroses, for welcoming us so warmly and for using her voice for maternal nutrition. What a crazy few years it has been since we all connected remotely at the last N4G, sitting in empty rooms in the midst of a pandemic, zooming in for virtual side events over the airwaves. And I'll admit, I was one of those people that was dressed about like this from the top up and then wearing pajama pants from here down. And the world has changed in really unimaginable ways even since then. We definitely do live in interesting times. May you live in interesting times. That old saying was actually intended as a curse, but for me it's more mixed. People in this room have traveled here from 6 continents. Many of you have made journeys that just 200 years ago would have taken your great-great-grandmothers months or years to complete. Imagine explaining your travel itinerary to your great-great-grandmother. You boarded a massive steel tube. It lifted over 7 miles into the air, traveling at near supersonic speeds, and it arrived here with you safely, thousands of miles away in time for this meeting. And if you're like me, you still complain bitterly because your steel tube was 45 minutes delayed in lifting off into the heavens, or because the system did not register your pre-ordered gluten-free vegan keto meal. In this room today, we each have supercomputers in our pockets. We have a hologram that's straight out of Star Trek, and we have a talking robot at the entrance powered by AI, another technology that we really wouldn't have been able to fathom just 4 years ago at the last N4G. And it's able to engage with you on a conversation on MMS and to pontificate on the state of the human race. Now, our AI robot is trained to be polite, but we should wonder, what does it really think about us, our species, in these uncertain times? Most of us in this room, in this city, live in unfathomable splendor with our supercomputers and our flying steel tubes and our diet fads. And yet, over 1 billion of our brothers and sisters are still denied all of these things. They're left to live in a world of neglect and of suffering. A world that looked a lot like the world our great-great-grandmothers struggled through. They live in a world where right now a child dies of malnutrition every 11 seconds. Though many of us rarely see this world, it's still our world. Deep down, I can't imagine our AI robot holds us in very high esteem. But we, this tiny community of global health and nutrition experts, will not be able to expand all of these miraculous benefits of modernity to the world's poorest 1 billion people overnight. It's going to be a long journey. I've been reminding myself recently that it took the abolitionist movement in my home country of America over 100 years to end chattel slavery. It was a long fight with many ups and downs. And our movement's in a similar fight to eradicate global malnutrition and hunger. And right now, it's clear, we're in the down. But even in this down moment, where budgets as well as bombs are falling on this very continent, our little community can make progress that is immensely meaningful for hundreds of millions of mothers and children. We really can. We can show a beleaguered world that progress is still possible. But we have to be smart, there's our robot, and we have to be focused. Because of the headwinds, and because we can't do everything or more than just a few things, we have to focus all of our time, all of our efforts on bringing the most proven and scalable solutions to the people who need them now. This event is about finally scaling up one of those solutions, which we've known about for decades, and which, though it's extremely simple, has immense power. We're here to finally scale good quality prenatal vitamins, known as MMS. This is happening, folks. We're going to make it happen despite the headwinds in this down moment. We're going to tick one big global inequity off the list. For too long, and even today, if you're pregnant in a high-income country like France, each day you take a prenatal vitamin that's packed with a full spectrum of the vitamins and minerals that you and your baby need. If you're pregnant in a low-income country, you don't. At best, you get just 2 of these essentials, iron and folic acid, in the form of an outdated supplement developed many decades ago. At worst, you're getting nothing at all. 20 years of research and 10 clinical trials have shown that when anemic women take modern MMS rather than outdated IFA, we see so many additional benefits. An additional 19% reduction in low birth weight, a 21% reduction in stillbirths. And Sean and I were just saying, I think this is the most powerful one. We see a 29% reduction in infant mortality just by switching one pill for another. And yet, despite having MMS having the backing of the Lancet and the World Bank and the Copenhagen Consensus, and despite it being on the WHO's essential medicine list, we're still at a point where most pregnant women in low and middle income countries do not have access. And that changes this year. We're going to finally replace this outdated supplement, IFA, with a better one, MMS, and we're going to rapidly scale it up around the world. It's time to make the switch. As you'll hear over the next hour, our group of philanthropies is making a historic financial commitment to jumpstart this global transition to MMS. And we're issuing a time-bound challenge for others to join us. You'll also hear from numerous ministries around the world who are also leading this shift. Dozens of governments aren't just waiting around. They're integrating MMS into their health systems because they know it works, because it's an opportunity to strengthen antenatal care, and because it's something they can sustain long-term. By simply scaling up MMS around the world, we can prevent babies from being born too small or too soon, and we can save millions of lives. We can help re-spark the child survival revolution. I'll end with this. This graph up here, no offense to our French host, I'd say it's prettier than any picture in the Louvre. For pretty much all of human history, child survival was a coin toss. If you were born, you had a 50-50 chance of surviving to adulthood. And this was the same everywhere. It was the same for the elites, and it was the same even here in Europe. In the 1700s, 1800s, it was a coin toss. Then, as you can see on the graph, in the late 1800s, bam, like a plane just shot out of the sky. And what's happening here? What's happening is the advent of public health and of science-based agriculture. First, in the early 1800s, the scale-up of the smallpox vaccine, then the scale-up of clean water and modern sanitation. And then in the 1900s, we see the Green Revolution and the scale-up of improved agriculture across developing countries. And then in just the last 50 years, that graph is still coming down, 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 because you're seeing the scale-up of childhood vaccines and vitamin A and affordable solutions to HIV and TB and malaria. Today, global child mortality is down to about 4%, from 50% to 4% in under 200 years. It's not a hopeful time, but that is a really hopeful message. I think an archaeologist 10,000 years from now is probably going to ask, what the hell happened here? I mean, these people must have discovered magic. They must have discovered the fountain of youth or the Holy Grail, and we did. But the magic wasn't just in the science. It wasn't in solving all of the world's problems all at once. The magic was in the scale-up, the dedicated, painful, often very unsexy work of actually scaling these solutions up. And it was usually just one or two at a time, and that's work that many in this room are doing every day. Now, this 4% brushes over immense inequities. In some countries, 1 in 10 children will still die before their 5th birthday. In these countries, we've left hundreds of millions of mothers and children behind, left to live in the old world, where survival is still a gamble, not a given. By scaling up just a few of the remaining high-impact solutions in these countries, we can halve child mortality again. It's our turn, the global malnutrition sector, to take up the paintbrush, following in the traditions of our public health forefathers, and make our own contributions, our own brushstrokes, to this beautiful picture of child survival. With half of the world's remaining child deaths due to malnutrition, it's so obviously our turn. In 2025, and these oh-so-uncertain times, let's make the scale-up of MMS the next bold brushstroke in this masterpiece of change. Let's make this revolution unstoppable. Thank you. Now, speaking of bold yet focused action, I would be remiss if I didn't mention my good friend Spencer Kirk. Many of you know him. For over 20 years, Spencer has been the fire behind the MMS movement. He has demanded urgency, he's pushed boundaries, he's pushed each one of us, and he has worked to make sure that MMS doesn't just stay a good idea on paper, but that it finally is beginning to scale. Spencer has dedicated two decades of his time, his energy, and his treasure to building the evidence around MMS, driving down the cost, and readying it for scale. Spencer is the most focused philanthropist that I know, and I think it's fair to say that without his 2 decades of singular focus on this issue, we would not be here today announcing these bold plans to finally rapidly scale up MMS. Spencer couldn't be here today, but he shared a message with us, and to deliver it, I'd like to invite his daughter, Olivia Kirk, to the stage. Olivia.
Good morning. I will do my best to convey my father's irrepressible enthusiasm for MMS, but bear with me as I hold up his favorite prop of all time. MMS, where to begin? The World Health Organization and UNICEF formulation of multiple micronutrient supplements is one of the most cost-effective and proven interventions of our time to deliver benefits for pregnant women and their children. As Will mentioned, it is an injustice that women in higher income countries do not have to think about having access for their children, while many women in lower and middle income countries every day have to question, how can I provide for my unborn child? That's why 10 months ago, Kirk Humanitarian made the first N4G pledge of $125 million in order to close this gap so women of all nationalities, races, and socioeconomic classes can finally have access to this little bottle right here. Thank you. As we heard from Will, more than 600,000 lives can be saved if we invest in MMS, improving birth outcomes for more than 5 million children and preventing anemia for more than 15 million women. Investments in MMS by national governments and other local development and humanitarian organizations are key for future sustainability and to prevent donor-dependent systems. Our efforts now and over the coming years are focused on ensuring that the resources are fully mobilized to reach as many pregnant women as possible. Currently, our private family foundation, Kirk Humanitarian, is supplying 90% of the global MMS supply. But no one entity can meet the needs of the world alone, and for this we are so grateful for our wonderful partners like ECF, CIFF, and many others. Now is the time to invest in women through MMS, to improve the health and well-being of millions of mothers and babies everywhere. It is a critical time when each of us must step up and ask how we can individually be involved to make sure that this critical intervention is in the hands of women everywhere. Thank you.
Thanks, Olivia. I'd now like to invite the spokesperson for our co-host for the event today, CIFF, my good friend Anna Jacobian. She's CIFF's Chief Impact Officer and the Executive Director of Nutrition there at the Foundation. Anna is such an important thinker in this space, and CIFF is one of the largest and most effective foundations out there working to scale up high-impact solutions to malnutrition. So Anna, over to you.
Thank you. Thank you so much, Will, and it's a pleasure to co-host this event together with ECF. And thank you so much, Olivia, for the beautiful words. And thanks so much to our dear friend Spencer for all the hard work over the years on this cause, and he's sorely missed here, but very well represented by you. So friends, I'm not going to speak for long. I think Will already set out the frame in terms of the journey on reducing child mortality and also the injustices that many women and girls are still facing currently. 2 out of 3 women and girls in the world have micronutrient deficiencies. We know that this really holds their life chances, and for those who choose to go on and have families, this really then undermines their chances of having healthy babies and for them to surviving and thriving. As Will already mentioned, we have very well evidenced solutions out there, and we believe that when embedded in strong health and nutrition services, micronutrient supplements such as MMS have a vital role in providing a healthy pregnancy for women and girls. A group of philanthropies, ECF, CIFF, Gates Foundation, and Kirk Humanitarian worked together to launch the roadmap, investment roadmap for helping scale MMS around the world. This roadmap looked at important evidence and research that was really helpfully created by many organizations, civil society, researchers in this room, worked with governments to really look at the country national plans, because we all know this needs to be very much owned and driven by countries. And we conducted some detailed costing analysis to really help translate this into action. And we estimated that we need $1 billion to help scale MMS to 160 million women around the world, to help achieve all of those outcomes that Will was mentioning from the evidence. So today I'm very pleased to announce that the 4 philanthropies that were behind the investment roadmap are committing at least $250 million towards that $1 billion investment roadmap. We believe that this is not only sending the right signal towards the $1 billion target, but is also showing our continued effort to do this in a harmonized way, to do it in alliances, and to do it in coalitions, because we cannot reach any of those goals alone. So philanthropies are also not going to do this all on our own, even though it's really wonderful to have this strong alliance of philanthropies coming together. So we're very much looking forward to domestic governments, bilaterals, multilaterals coming to join us in this goal of helping to raise $1 billion to help reach 260 million women. We estimate that this is going to help save 600,000 lives by 2030, prevent 5.3 million vulnerable births, including stillbirths and low birth weight, and reduce 15 million cases of maternal anemia. Thank you so much for everybody who's made the time to come and be here with us, and we really hope to work with you in union to help achieve these goals. Thank you.
Thank you, Anna. We'd now like to invite our last philanthropic partner to speak, Raul Rawat, who is the Deputy Director for Reproductive, Maternal, Newborn, and Child Health at the Gates Foundation. The Gates Foundation needs no introduction, but they really were a driving force behind building much of the evidence around MMS over the last 20 years and continue to be a driving force to scale it up now. So, Raul, thanks for being here. Over to you.
Great, thanks, Will and Anna and Olivia. That was great. So I know it's hard right now in this environment to be very optimistic about the development sector, but I do want to take a moment to celebrate progress in our sector. And part of that is the Child Nutrition Fund. This was launched by UNICEF with initial support from the United Kingdom's FCDO, the Children's Investment Fund Foundation, and the Gates Foundation. And there have been many partners that have come on board since it was launched. But this fund is really an effort to rethink how we finance nutrition. It's designed not just to fill the gaps, but really to think about incentive mechanisms to amplify country leadership and to mobilize smarter investments. One of the most powerful features, I think, in the Child Nutrition Fund is a match mechanism that exists. So when a government invests in a nutrition commodity and service, MMS is a perfect example of that, the fund will match the country government dollar for dollar. So we're really in a position now to turn aid into a catalyst. It really encourages domestic ownership and creates clear accountability. But the fund also works on the supply side of the equation. It helps manufacturers forecast demand, access working capital, and really help scale production. And given the numbers that Anna referenced, we really need more supply if we want sustainable regional supply ecosystems to meet the growing demand. And I think we can take a page from the playbook of other sectors, and one to look at is vaccines. They really do have a toolbox of financing solutions. And that has really transformed access for millions of children around the world. These tools de-risk the market, incentivize supply, and drive down prices. But frankly, for nutrition, they've been very underutilized. But I think that's really going to change, starting with the Child Nutrition Fund, but also through other efforts for many partners in this room. So I'll talk about a couple of examples. Volume guarantees is a good one. In the vaccine space, they've really stabilized prices and encouraged suppliers to scale. We haven't done that in nutrition. But in nutrition, if buyers commit to predictable volumes, suppliers can plan and produce more efficiently and ultimately pass on those savings to governments. That could make nutrition products more affordable, more available, and in some cases, locally available and produced. Another thing is procurement guarantees, which are commitments that provide a floor price at a purchase volume. And MMS is a perfect product where there's sort of uncertainty, but it would really help ensure that the supplier is entering a market with some guarantees. And lastly, pooled procurements. These are a familiar tool in global health, and it's just another opportunity to pool demand across buyers and across countries. UNICEF plays an important role through their supply division in some nutrition commodities, but I think we can do a lot more, and MMS is a great example of that. So I'll just end by saying these tools aren't new. We talk about them being innovative financing tools, but their innovation is relatively old for the other sectors, but for nutrition, they've been really underutilized. So I think we need consistent application of the tools, and we can really move from isolated pilots that I think has been the norm in our sector to strategic, scalable financing models. And so the Child Nutrition Fund gives us that foundation, a glimpse into what's possible when we align incentives, center country leadership, and think differently about how we fund this work. And I think we need to build on that momentum. The solutions do exist, both the MMS as a product as well as the financing solutions. What is really needed now is coordination and increased risk tolerance from donors and country governments, and really a boldness to bring them together. So thank you very much.
Thank you, Raul. Okay, so we've saved some of the best for last, folks. To close this out, we have a really exciting panel of government leaders who are leading this shift on MMS. And I'd like to welcome Sean Baker, the Chief Program Officer at Helen Keller International. Sean's a longtime leader and champion of this sector. So Sean, welcome to the stage. Sean's going to introduce our panelists, and he's going to moderate the discussion, and then he'll close us out.
Thank you, Will. Thank you to these generous philanthropists. A special call out to Spencer, who truly has been a force of nature. I was recollecting that I was actually in one of those original consultations when we were coming up with the formulation should be, and I think that probably is some testament to my age. I'm going to start off, we're going to do a few things. We're going to make a few acknowledgements. We're going to call up some panelists. We have the Honorable Minister of Health of Côte d'Ivoire who's going to take some remarks. Pas encore. But first, before we start there, I'm going to have a bit of a test here. Please raise your hand first if anybody in this room has been pregnant. I've not been pregnant. Go ahead. Okay, keep your hand up. Next, have you ever known somebody? Have you had a partner who's been pregnant? Yeah, keep your hands up. Have you known anybody who's been pregnant? Okay, I think we have universal coverage here. Okay. So each and every one of you in this room knows somebody who either has benefited from prenatal vitamins, multiple micronutrient supplements, or could have. And that goes back to some of the questions at the beginning, the incredible inequity, how in the global north this has been standard of care for decades and decades and decades. But in a country like where I live, Senegal, where women have far greater risks of micronutrient malnutrition, we only provide them 2 nutrients if they get any supplements at all. The next question, have any of you ever been involved in the national level advocacy and scale up of any maternal supplement, either iron, folic acid, or multiple micronutrient supplement? Okay, so at least half the room has got some real skin in the game here. And then the final quiz, before we get into discussions. This is a Nutrition for Growth Summit. We're here to pledge for action. Has anybody here been involved from your government, from your organization, in making a commitment related to multiple micronutrient supplements? So we're seeing some action in this room, but there's room for more action. But thank you, everyone, for that. Before we call up the panelists, we have the Honorable Deputy Minister of Health from Egypt here in the room. Thank you so much for joining us. Your leadership is very appreciated. And we also have another champion for nutrition for many things, l'Excellence le Ministre de la Santé de la République de Côte d'Ivoire.
The Minister of Health of the Republic of Côte d'Ivoire. I would like to apologize with my Senegalese partners because they are champions of Africa as well. And one of the reasons why Côte d'Ivoire is still a champion in Africa is investment in nutrition. So if you would like, please, could you take the floor in order to provide us with a few remarks on multiple micronutrient supplements? Minister?
Merci.
Thank you very much, ladies and gentlemen, dear guests. I am delighted and honored to take the floor before you today on this very special day for public health. That is to say, this summit for nutrition for growth. We need to transition towards a supplementation in MMS. Côte d'Ivoire has a multi-sectorial plan 2024-2027 that gives priority to fighting deficiencies in micronutrients. When it comes to this, I would like to recall a few figures. First and foremost, the prevalence of small for gestational age birth, 10% for low birth weight, and also anemia in women, 71%, and deficiency in nutrients is still a majority for women and young children. But we see that deficiency is not only limited to iron. We have other deficiencies, especially zinc, vitamin A, folic acid, iode as well. All of this contributes to anemia and other complications. Hence, it is essential to adopt an integrated approach in order to improve nutrition and enhance the health of our citizens. Côte d'Ivoire has decided to lead transition by supplementing multiple micronutrient supplements. We do believe that this approach will allow us to have a better impact on limiting low birth weight, premature birth, and also on improving the maternal health for pregnant women, also with IFA treatments. This solution will be based on other pillars with an enhanced political framework, sustainable procurement, and also more awareness raising. We will be working with the WHO and other partners within the UN. We will also be working with the civil society and the private sector in order to make sure that those initiatives will become a success. We should commit to improving maternal health and the health of children in Côte d'Ivoire and in the whole world. I would like to thank the Eleanor Crook Foundation for organizing today's meeting and exchange, and we do believe that the outcomes and conclusions of today's workshop will be used for good. Thank you very much.
A theme that you may have been hearing throughout the last week is that we need financial resources, but we also need human resources. And so I have the privilege of calling up to the stage some of the most brilliant human resources in nutrition one could ask for. I'm going to start with, je vais commencer avec ma sœur.
I will be starting with my twin sister, Patricia Ngoran. Please join me on stage.
The head of nutrition in Ghana Health Services, Olivia Tempo. We have a delegation from Bangladesh who are supposed to be coming, but I think they've been sequestered in summit meetings. So even though Bangladesh has generated tremendous evidence for multiple micronutrient supplements is scaling up, we will have to hear from them later. I was also fortunate I've been making some new friends here. Samali Namakose from Uganda. Hiwat Darseni from Ethiopia. And then a representative from Nepal, Dr. Bibek Kumar Lal. And Nepal also has also contributed enormously to the global evidence base on multiple micronutrient supplements and is running with that evidence base and turning it into impact. So I think all of you should have microphones, so you're all empowered. And I'm going to start off actually with one quick question for everyone. You've been leaders of convincing bureaucracies to transition to multiple micronutrient supplements. And can you say in less than 30 seconds, what has been the key message that you've used to do that? So let me start, should I choose? Hiwat, would you share, if you're locked up with a decision maker and a very short elevator ride, what's the one key message you get across?
Okay, thank you very much for this chance in presenting Ethiopia. So I would say investing in nutrition is like not only for the child, but it is transformative of the country in prosperous development in human capital.
Thank you. Samali.
Yeah, the key message here is that MMS works and we can have healthy babies, healthy mothers. And that is the statement I've been using to convince the policymakers.
Excellent. Olivia.
Good afternoon, everybody. Thanks for having me. What I would say is that MMS does improve birth outcomes and for mothers and newborns, and so we should invest in it.
Patricia.
Merci.
Thank you very much. Well, the Minister of Health is here, and obviously I did not have to convince him, but we spoke with the Minister, and then he conveyed it to the President. But what did I say to the Minister? I said, well, let's go, and let's go together, because I'm convinced, and I want to convince you, because those MMS actually reduce child mortality. They reduce the risk of baby mortality, and it also allows us to decrease preterm birth. And on top of this, we have evidence, we have proof, because we need scientific proof. If we did not have scientific proof, I would not have committed the Minister in this approach. So thank you very much, Minister, for being present.
Passion. Dr. Bibek.
Thank you. I think if it was for an elevator pitch, I think which I've already made to our minister, and he has
Successfully.
agreed, yes, successfully, that I told him we have done a lot in the past to improve maternal and newborn health, but now we have reached a plateau. So if you are looking for a cost-effective way to reduce maternal and newborn mortality, MMS would be the next step. It would be a game changer that you could initiate during your tenure, and he readily said yes.
Obviously, a smart technocrat with great political instincts. I will share an anecdote. Obviously, I look at the evidence. What may have made me even more passionate was visiting Cambodia about a year ago and speaking with a midwife where we were working with the government to test for introduction and running iron folic acid compared to multiple micronutrient supplements, but most importantly, speaking to women who had had at least 2 pregnancies, one with iron folic acid and one with multiple micronutrient supplements, and their testimonies. So bringing together that evidence with those personal testimonies about how they like it so much better, it doesn't create the side effects, they feel better. It's nice to have a product that is more efficacious and clients like better. That's pretty good. Now we're going to dig into some more detailed questions. So get ready, panelists. Patricia, en fait, je vais vous passer...
Patricia, I will give the floor to you. I know that one of the commitments for Côte d'Ivoire in view of this Nutrition for Growth Summit is this transition from iron and folic acid towards multiple micronutrient supplements. And for you, if you could maybe develop further, why was it important for you and what were the different steps for you, Côte d'Ivoire? Well, thank you very much. Indeed, the minister, during his speech, provided a number of figures, but I would like to come back on a number of figures, that is to say, children mentality. So we went from 108 out of 1,000 to 74 out of 1,000. 385 when it comes to maternal mortality. So we reduced it by half. It's still very heavy, but we reduced it by half. And if we look at the first cause of maternal mortality, it is hemorrhage during while giving birth. That is to say that women who die while giving birth, well, this is extremely painful. And I would like to say that the minister would like to reduce this infantile death. And also 61% of women are anemic. So this opens the door to hemorrhagic birth. So by taking this commitment, we should wonder on the following. How could we associate those two issues with MMS? How can we reach it? And the plan, the sectorial plan for nutrition that was adopted in the Council of Ministers wants to correct anemia. 61% of women are anemic. So first and foremost, we need to correct before even thinking about prevention. This being said, we should think about both strategies, correcting and preventing. By engaging in MMS, we want to place those strategies into a new context, so aligning both of them. Prevention, avoiding that we have new cases, but also correcting the cases that already exist. Hence, with MMS, we established a roadmap, but we want to see how in the procurement we can work with both of them. That is to say, heighten the value of iron in MMS by combining MMS with iron and folic acid in order to correct the gap that still exists. We agree on this, we will engage on this, and I do believe that we will reach this goal.
Olivia, I know that Ghana has taken steps in integrating multiple micronutrient supplements into the health system, and I think part of the challenge, I often say to my colleagues, replacing poorly functioning iron folic acid supplementation with poorly performing multiple micronutrient supplementation is not really the victory we're looking for. We're looking to get as many pregnant women as possible access to these. So if you could share with us some of the steps you're taking in Ghana to both transition and use this as a leverage to increase the quality of prenatal supplementation.
Thank you. We all do agree that the evidence is clear that MMS actually leads to better health outcomes compared to IFA. Therefore, last year, Ghana started exploring activities regarding how to introduce MMS. We started off by trying to introduce it into guidelines and protocols for ANC, antenatal care clinics. We wanted to leverage on the high ANC attendance because we realized that in Ghana, at least 98% of our women receive the IFA during the antenatal care for 90 days. And then about 88% receive it during 4+ visits. So we wanted to be sure. Our attendance is actually 98% for at least one visit, and then 88% for 4+ visits. And about 96% take the IFA, receive it for 90 days, whilst about 66% receive it for 180 days. We won't say that receiving it implies actual consumption, but at least we want to leverage on this opportunity to reach out to the women. And so we have taken steps to include this in our standard treatment guidelines. We've taken steps to include it in our essentials medicines list. And then we are engaging stakeholders. We are looking at the challenges that might occur in taking this path. We are looking at how to ensure that we get their buy-in. And then we're also looking at evidence from implementation research. We want to look at feasibility, acceptability, and to be sure that when we introduce it, the women would comply. So these are some of the few things we started doing since last year.
Thank you so much, and I look forward to coming to Ghana next time and seeing it in action. I'm going to move to East Africa, but Hiwat, before I call on you, I want to recognize a nutrition champion from Ethiopia in the audience, His Excellency Demoke Mekonnen from the Federal Democratic Republic of Ethiopia. Sir, thank you. Thank you for coming. And if my information is correct, I think Ethiopia is having the largest scale up so far in Africa of multiple micronutrient supplements, and you've developed a costed roadmap. So could you speak about your strategy for sustainably funding this transition from iron folic acid to multiple micronutrient supplements? I first of all, though, should congratulate you for this incredible step forward. So congratulations, and share with us some of your lessons.
Okay, thank you. So as my colleagues shared their experience in terms of maternal nutrition, Ethiopia is one of the high burden in terms of micronutrient deficiency and diet diversity score among pregnant and lactating moms. So even though iron folic acid is universally available and it is provided free of charge and it's integrated in our antenatal care program, the adherence to optimal coverage is not as such, which is only 1 out of 5 mothers are adhering 90 plus of the iron folic acid. So one of the reason with many of the pocket studies, it is the compliance side effect of the iron folic acid due to the iron. So we started to thinking the opportunity to have this MMS. Back in November 2022, we started that demonstration and we managed to reach like 250K pregnant mothers and additional 400,000 mothers in emergency affected areas in the coming or at the end of 2025. So for the smooth transition of IFA to MMS, including the sustainable financing, with the leadership of Ministry of Health in collaboration with nutrition development partners, research institutes, and other key stakeholders, we took some of the steps. One is the development of costed comprehensive MMS roadmap. As part of the development process, we did situation analysis with current intervention of MMS and other enabling environments such as the antenatal care and entire maternal nutrition services. And through, we did thorough analysis of those intervention. The other one is stakeholder mapping, since it needs private engagement, the academia, and so on. So we did stakeholder analysis. The other one is as part of the evidence generation. I mentioned earlier, the 250K is as part of the demonstration, and we are undergoing the operational research with a local institution in collaboration with London School of Tropical Medicine, and also evidences elsewhere in the world with a form of desk review. And the other one is we conduct thorough co-creation process with all key stakeholders. And going forward, we are looking forward on the costing of this assessment, because the roadmap is ranging from the 6 WHO building blocks in SBCC, because one of the challenge was demand creation and early initiation of antenatal care and enrollment of moms throughout the process. So that is the case. After costing, after we will manage to finalizing the costing process, we need financial planning, what is needed, what is available, and what is the gap. So the gap should be closed or mobilized jointly with donors. So far, the CIFF or the foundation, CIFF and the Gates Foundations are supporting, but we need mixed or wider range of donors. The other one is the government commitment, because we are managing to procure iron folic acid for the past decades. So we need that kind of matching approach or any kind of schemes, and also engaging thorough evidence generation and so on. Those are the lessons, and those are the steps for smooth transition of IFA to MMS. Thank you.
No, thank you very much for sharing those lessons with us and that methodical approach. I also wanted to just build on, I think we've also seen every place we've worked, in fact, the adherence or the compliance seems to be much better with the multiple micronutrient supplements for the reasons you've stated. Samali, Uganda, I know you're working with multiple partners for implementation research, for policy change, who are there to support the Ministry of Health. And so could you share with us how you are orchestrating this multi-partner approach in Uganda?
Thank you very much. Yeah, thank you very much. I want to say that it is true, Uganda is driving a multi-partner approach to systematic introduction and integration and scale-up of MMS in the health system. I want to say that it is government-led. That means that we have to align to national priorities and international priorities, and also to ensure that it is sustainable. One of the things that we have done is to establish a very strong coordination mechanism. We have a working group on MMS, and we have various members represented. We have departments from the Ministry of Health. We have nutrition. We have reproductive health. We have pharmacy. We have health education promotion. We have health information. We have partners represented on this group. We have UNICEF. We have Vitamin Angels. We have Makerere University. We have CHAI. I'm happy that the representative is here. We have Eleanor Crook Foundation through CHAI. They are supporting. And recently, we have the CIFF, Child Investment. Yes.
Children's Investment Fund
Yes,
Foundation.
CIFF.
That's why we call them CIFF.
CIFF in short. So there are discussions that go on in this working group, and the recommendations and discussion feed into the senior management committee, which again feeds into the health policy advisory committee, and thereafter top management. And I want to inform the meeting here that we have always provided the updates on our MMS implementation to all these groups, and next month we are scheduled to inform the top management committee on what we have done. The other thing is around institutional leadership for the new product. We have a group that is responsible for introduction of any new product in the country. And they are there to guide in the market shaping, the sustainability. They look at issues of data, monitoring and evaluation, and also demand generation. And this is really to ensure sustainable and well-structured MMS rollout in the country. The other intervention that we are doing is the evidence-based policy and programming. We are leveraging on the implementation research to inform our decision making, policy direction and programming. And we are doing research, as I mentioned, and the insights around acceptability, feasibility, and the comparative advantage on obstetric factors of MMS over iron and folic acid, really informing our policy direction. So I want to say that we have finalized the formative phase of our implementation research, and now we are going into implementation where MMS will be given to the mothers, and we see how this works out in the country. The other one is the costed implementation roadmap. We have already worked on this roadmap, and would like to cost it, and this will be a resource mobilization tool. I want to say that in this roadmap, we have also partner mapping. We want to see which partner can handle what areas. So we are moving systematically. Sure, and we want to ensure that we sustain it. Let me take this opportunity to appreciate all our partners who are present here. In the case you're a partner and you have not heard your name, I want to say that Uganda is ready to work with you to make sure that we extend this important benefit to all the mothers. Thank you.
Thank you so much. I think all of them deserve a round of applause, but I think that the government owning this agenda and we partners being able to step in and support you is so inspiring. Dr. Bibek, I'm going to come to you. Don't feel that I neglect you, please. As probably many of you know, Nepal has contributed enormously to the global evidence base, and also I think it's probably one of the countries with the highest performing iron folic acid supplementation programs, in large part due to this tremendous asset of the female community health volunteers who are legends. So as you look forward, Dr. Bibek, could you share with us what you're looking at for sustainable funding of the transition to multiple micronutrient supplements? How can partnerships with development partners, potentially the private sector and domestic funding, how can these come together to help this transition?
Thank you so much for that kind note on Nepal. And
it's evidence-based.
Yes, yes. So thank you for that. And as you yourself has stated, we have always followed science when it comes to adoption of new policies and interventions. And that has been the case when we started discussing on MMS, transitioning to MMS. Thanks to the support from ECF through Helen Keller International, we have done this landscape analysis, the supply side assessment. We have also looked at the regulatory environment and also looking at the community engagement, and finally implementation studies also right now being carried out. So we are almost there in terms of policy readiness when we will be switching from IFA to MMS. And as you know very well, when it comes to IFA and any other nutritional interventions, government has been providing free of cost throughout the country. Yeah. So cost is the biggest factor. I need not state that here. So I think our colleagues in the opening statement had suggested many innovative and well-established methods that could be followed for MMS as well. And if I had to put it plainly, I think the idea is to make sure that the governments as the procurement agent find it, the cost to be similar to that of IFA if they were to overnight switch to MMS, whether it be through subsidies, through co-financing or some catalytic funding, pool funding, whatever terms there are for financing. So I think it would have to be a mix of all. But this year is not the best time to ask the countries to come up with more domestic funds. As we all understand, within few weeks, things have changed drastically. If I were to talk about my own program, we manage the broad range of programs related to maternal, newborn, child health, nutrition, immunization, everything. And I am facing a significant cut in my own program. So I do not know how I'll sustain the current ones. So when it comes to adoption of new interventions, there will have to be some catalytic support from our partners. And we are looking for that so that we can at least start it and get more domestic, support so that we can switch through our own resources from IFA to MMS. So it will be a long process and it will require some additional, what I would call is demand generation among the policy makers to reach there. I hope I've been able to answer it.
No, I think make sure you have Rahul's number, because I think you've just made the case in many ways for the Child Nutrition Fund and the premise of how we want this to work. And I think that I appreciate your being so honest about the real fiscal constraints, and we need to be cognizant of that, and then how do we work hand in hand with governments to make this happen and create that pathway towards sustainable financing. A brilliant set of questions, and now I'm going to ask you to summarize. There's a big audience right here. I think there are also a lot of people who are tuning in, and you all, I mean, I'm just so inspired hearing this. If you go back, like even 5 years ago, we were still talking about the basic evidence, and to see this incredible tipping point of countries grasping this and running forward is inspirational. So I'm going to start just asking each of you to share if there's one lesson learned that you have from your journey so far you would like to share with the audience here in the room and online, what it would be. And I'm going to start with Hiwat from Ethiopia, because you're a treasure trove here of experience, lived experience of how to make this happen.
Okay. One lesson from this MMS demonstration pathway, the coordination and the convergence is the key aspect, because it needs, it's not simple just to introduce or switching IFA to MMS. It needs local production aspect, so it needs public-private partnership. It needs evidence, because it has to be context-specific, because we have to improve the compliance and other aspects of that challenged by iron folic acid. So the community perception has to be changed. So it has to be supposed to change with SBCC. So we have to devise a way for strong SBCC, starting from demand creation, for advocacy, which is for decision makers to finance, to own it, and for not challenging with sustainable financing. The other lessons is, in my view, MMS is not just as a product, but it is an opportunity to transform our maternal nutrition in general. So for me, it is not like switching IFA to MMS, but it is a transformative instrument to transform maternal nutrition in general. So this is the lesson that I got. Thank you.
Thank you so much for sharing that. Could I go to Samali? What is a key lesson you would like to share with the broader world?
Yeah, thank you. The key lesson is stakeholder engagement. It's very, very important to have buy-in from the various stakeholders. The Ministry of Health, top leadership, the different players. The second is demand creation. It requires a lot of social behavior change, communication for uptake of this service. So that is really very, very important. Those are the two which are major.
Thank you so much. Olivia.
Before,
Patricia, je pense que tu as saisi la question.
Patricia, the question is the following. What are the lessons learned that you could share with everyone, please?
Listen, I would like to thank Chai and ECF. When I listened to her list of partners, I was like, woo, she's so blessed. I would like to thank Chai and ECF for supporting government to get this done. It's something that we wanted to do long ago, but last year when they came in, their support has pushed this agenda forward greatly, and we are looking to doing more with them. And the other partners here, those she mentioned, CIFF, etc., we are also open for more support. One of the lessons I learned is thinking about sustainability right from the beginning, because at the end of it all, if uptake improves and compliance improves, we would have to find a way of ensuring that the supplements are available, they are accessible to that rural mother down there. And so we need to ensure that we think about how countries can produce locally and ensure that it is readily available. And so we should put in systems to ensure local production, because in my country, for instance, that is one of the greatest challenges we've seen, getting our pharmaceutical companies to support local production and to produce it according to the standard we are expecting. They want to produce it, but the standards and specifications are not as we would want them to do. And then secondly, ensuring that we have systems in place to manage stock, etc. Because in some instances, you may have access to it, but if you do not manage your stock very well, you have wastage, expired products, etc., leading to a lot of costs. And so we should ensure that we have systems in place for stock management, and governments should be made responsible. If they also make some commitments by purchasing or producing for their populace, it is much more sustainable. Thank you.
Thank you so much. Patricia, partagez avec nous quelques leçons apprises.
Patricia, would you share with us a few lessons? Well, thank you very much. I wanted to speak about exchanges, and we can say that we are satisfied because we are not alone. Maybe you're the last one, but you might also be the first one because you're able to draw the lessons of all those who started. And I can guarantee that we will be moving very swiftly in this strategy that we are trying to implement. What I wanted to say also is that Côte d'Ivoire strategy will be enshrined in a multi-sectorial national plan with several actors, several players. And when the Minister of Health, who is here, well, he knows very well that this is a challenge in the framework of public health to make sure that primary health services are getting closer to the community. We need to offer them a package of services. You know, there is a major challenge in Côte d'Ivoire. It is prenatal consultation, the first medical consultation. Because, you know, if the doctor meets the woman and she's already 8 or 6 months pregnant, it's a little too late. So we need to act as soon as the pregnancy is revealed. But in our context, in the African context, actually, not only Côte d'Ivoire, but others, hence we will be sharing our experience and learn from one another. Well, sometimes a mother, because this is cultural, a mother will struggle to tell you, I'm pregnant. You need to observe that she is pregnant, and we should know that there is a lot to be done in order for us to arrive in time and provide her with a supplement. So we are enhancing the political framework in order to make sure that health services will be more accessible for population. Right, Minister? And then we also have a universal health coverage that is being implemented. So when we are talking about procurement, about gratuity, about all those services, it has been thought about. And I do believe that all these inputs will integrate in the universal free health coverage policy. And let me say that, you know, in the hierarchy, we've heard for a very long term that funding is always an issue. It's always a problem. But I would like to let you know that we are committed. And when we commit, it means that we will contribute from a financial viewpoint. So I'm looking at my partners, and I do believe that the effort of Côte d'Ivoire should have an echo. It should be a catalyst in order for all of us to work together. So we've been listening to research, to assessment. All of this is very significant in all our actions. If we do not assess, if we do not take stock, we will not be able to move forward. And this was said several times, and it will be a lesson for us. And I do believe that we will be there when we'll be meeting again and taking stock of where Côte d'Ivoire will be. I can tell you that in a few years we'll be very far.
Champion.
Well, thank you very much. And Minister, you'll be one of the champions, especially in the French-speaking region of Africa. Dr. Bivak.
Yes. Now you have the last words of the panel. See, so
I think during this entire
because
process,
you're a leader, so you get to speak last.
I think there were two main points I'd like to emphasize. First is political commitment. All of us who work in public health know that if you have a good public commitment from the political level, I think half of your job is already done. And next is the consensus building exercise that we had as part of the landscape analysis. It taught us a lot of things. There were unexpected, unanticipated queries and concerns that were raised by different stakeholders. So it gave us time to prepare ourselves. And as we are going to move further into rolling out, I think we would be on a stronger grounds. We would have anticipated queries and be ready to address any, so that I think we'll have a smooth rollout whenever that can be. So I think those 2 points I'd like to emphasize. Thank you.
Thank you so much. May we have a huge round of applause for our panelists? This is why it's fun to work in nutrition, because we have such incredible technical talent, but the passion and the drive and the political astuteness. Now, I'm supposed to wrap up. We started off with a chef. I like to cook, but I like very simple recipes. And so I think I heard 5 key ingredients. We can add to ingredients afterwards, but I'm trying to simplify. I think the first point, the evidence is absolutely compelling. This is a huge step forward in improving women's nutrition and improving the health and survival of the most vulnerable infants in the world. It is a huge issue of equity, totally unacceptable that in the global north, this is the standard of care for decades, and the global south, where in fact pregnant mothers face many deficiencies, that we're only providing them 2 nutrients. That it's beyond multiple micronutrient supplements. How do we use this as a true catalyst to take seriously maternal nutrition, which is maternal health and nutrition? There's a big rollout of antenatal services, prenatal services. We often see the quality of those services is not what it should be. And here's an opportunity to really take that seriously. I really like the point of we're in this for the long term, so we need to start planning for the sustainability of the long term from the very get-go. Let's not have little boutique interventions. This is from the get-go plan of where we want to be 10 years from now. And then that government-led coordination and political leadership is catalytic and truly will be transformative. I will close. One of the great pieces about being back with Helen Keller International is Helen Keller is an incredible inspirational figure and a wonderful woman to quote. And a quote that I am using much right now is that although the world is full of suffering, it is also full of the overcoming of it. And it's just a pleasure to be in this room with so many people dedicated to overcoming the suffering of malnutrition. Thank you so much.
I'm not even listening to. No, I'm not even.
Anyway,
Yeah.
I panicked. Yes.